Now, it's Mandy Connell. On KOA, 850 AM.
94.1 FM.
Mandy Connell keeping ignorance at bay.
Welcome to the third hour of the show. And as they used to say on 70s television, it's a very special edition of the Mandy Connell Show. This last hour, we are going to talk about something that I am so excited about on a daily basis that I should work as the spokesperson for the freaking industry at this point. Direct primary care, medical health share plans. These are two things that you can use to change your health care delivery life, honestly. The current insurance system sucks. We all know this. We know that the Affordable Care Act is nothing like affordable. We know that it has distorted the market even more. We know that everything is too expensive. We know we have crappy plans that don't get us access to our doctors and don't even kick in until we've spent 10 grand a year. We already know this. So what we're talking about today is an alternative. And it's not like a pie in the sky alternative, like we should try this. This is working for so many people already. So it is a healthcare roundtable about alternatives. And joining me in the studio right now is the founder of Pinnacle Advanced Primary Care, Dr. John Dyer.
Thank you very much for having me.
How did you draw the short straw to come here and talk about this today?
I think, I don't know. I think April just gave it to me actually this time.
Well, you guys both can talk about it quite eloquently.
Thank you. I appreciate that. But I guess I got the long straw, actually, because I'm the one who gets to talk about it with you.
Oh, there you go. And also with us, Lisa Fagan. You've heard her on the show before. She is with Smith Medical. They are a cash pay surgical center with a delightful pricing menu. I went and looked at it today so I could, plan my little touches and nips and tucks as I move forward and have a real idea of what things cost. And, I kind of want to start with how you both ended up going in a completely different direction. I'm going to start with you, Dr. Dyer. You're an MD. You're a medical doctor. You went to medical school for all those years. Then you get out and you start practicing. Tell me about that experience.
Well, I think part of it just came out of necessity for me. I mean, I was starting to get burnt out. And it wasn't because of the patients or the people I worked with. It was because of the system. It seemed like you would do 2 hours of clerical work for every 1 hour of patient care. And that wasn't what I envisioned when I got into the industry. So about 2014, so it's been more than a decade ago, I started listening for alternative options. And I listened to Dr. Josh Umber with Atlas MD out of Wichita, Kansas. And actually, in the same podcast that I learned about direct primary care, I also learned about Surgery Center of Oklahoma, which is a direct specialty care. And, it's the same folks that do Smith Medical. So I was like, man, I want to be part of that. So I had to finish out my contract at the little town I was working at in Kansas, in Colby. And then I left that and went right into direct primary care and haven't looked back.
What are the differences in how you get to practice medicine?
Well, like I said, you had to do so much paperwork and you had to do so much billing and coding stuff that didn't really provide any value to the patient. And you could tell that. Like no patient ever goes to the doctor and leaves and says, wow, they're so good at coding. It's not what happens.
They know their codes over there. It's
right.
Magical.
But that's honestly, that's what was in the forefront of your mind when you were in the fee-for-service insurance-based system, is you had to make sure you connected all the dots. You had to have certain points in the history. You had to have certain points in the review of systems and the physical exam in order to meet a criteria for a level that you could charge and then bill the insurance company for the care of the patient. And when you have that in the forefront of your mind, you're not thinking about the patient, which was disturbing to me. And that's the first thing I noticed when I got into direct primary care is all of that was gone. Like you could just focus on what the patient was telling you, listen very carefully. It was like a carpentry term that I heard back when I was younger, which is measure twice, cut once.
Right.
It was like that. So you could do a better job when you're there with the patient, so you didn't have to go back and collect all the loose ends later.
Lisa, I want to come to you because you work with Smith Medical, and Smith Medical is actually named in part after Dr. Kevin Smith, who I interviewed in 2007 on my radio show in Florida about the Oklahoma City Surgical Center. And that is what you're named after. But how did Smith Medical Specialty Care come to being here in Denver?
Yeah, so two of our founders met Dr. Keith Smith through another company called HPA, which helps physicians stay private instead of going into the healthcare systems. And they met Dr. Smith and they were like, this is incredible. Why are you not doing this all over the United States? And he's like, I'm just going to focus on this one, but I'm welcome to give you the blueprint and help you open it. So these guys were like, oh, well, let's open one in Colorado. And Dr. Smith sat in our board for a little while. And we asked him if we could name our company after him.
I love that.
Yeah, he's so great. He's wonderful.
I mean, think about that for a second, though. He gave you like the keys to the kingdom by saying,
Absolutely.
I'll help you and tell you what you need to do. That indicates to me that his motivation is far different than some of the other motivations in medicine today, right? I mean, his motivation is truly helping people and getting them the health care that they need and truly deserve.
Absolutely. And we all work together, which is great.
Now, I've also got with us today from Zion HealthShare. And this is the part, Preston, we're going to get to you in pretty good depth here in the second part of the hour, because a lot of people, I've gotten so many questions in the last month about how direct primary care works and how Zion HealthShare works with all of this. So I kind of want to, if you could, just give us a quick overview. We got to take a break in about 2 minutes. Can you give me like a thumbnail sketch of how HealthShare works to lay the foundation?
Yeah, so really, a HealthShare is a community-based alternative to traditional health insurance, right? It's a place that members can come together to share one another's eligible medical expenses and needs. And unlike insurance, it's built around transparency, right? Simplicity, shared responsibility, rather than focusing on profits and growth of the overall company.
What are the big questions that I get? There's two big questions that people have. One, they're like, tell me about pre-existing conditions. That's one of their concerns.
Yeah, so there's one benefit, and also it's kind of a downside for some people, is that, hey, we're not ACA compliant, so we are able to put into our guidelines, there are some things that, hey, we don't want you to come into our community if there are certain restrictions that don't make sense for our community to take care of, right? And so there is a look back period of 24 months of, hey, if there's something that you're actively, treating or taking medication for, then, hey, that's not something that we feel like this is part of the community's responsibility. But we do have a waiting period, right? So if you do come on and you've got something going on after the first year, there's a $25,000 limit. And then that tiers up after about 4 years. And then that thing is no longer considered pre-existing. We call them pre-membership, but it's no longer a pre-existing condition. And now it's fully shareable. And it's something that, hey, this is part of the community now.
If somebody has a question specifically to that, when they call Zion, could you answer those specific questions about specific health? People are sending me their medical history. And I'm like, I am the wrong person to answer the questions about whether or not that, and I'm so sorry you have that, if that is going to be a thing. But can they get those specific answers for you?
Absolutely. So there's actually a couple things you can do. We have a fantastic sales team. We've got a member education team that they're just literally sitting in the office right now waiting for the phone to ring so that way they can answer those questions. But we also post our guidelines, our member guidelines on our website. Anybody can go and read through those guidelines. We actually require that you read them before you join our HealthShare. So that way you don't feel like there's any sort of, blindside situation for them, right? But absolutely, if you've got a situation that you want to understand a little bit more, hey, I've got this situation going on. When I joined Zion, it was very much a like, okay, well, I've got this, and can I be part of the community? And it's a very sympathetic conversation of like, hey, yeah, absolutely, let's chat about this. These situations, hey, this may not be a good fit for you, right? And in those situations, that's where it's like, you know what? I'm not a huge fan of insurance, but insurance is there for those purposes.
Exactly. And that's the thing. It's part of it. Oh, I got to take a quick break. When we come back, I want to talk about how this works, how all three of these work together to create like a safety net. And I want to get into specific examples after we do this. We'll be right back. Keep it on KOA. We are here talking about health care. I got a couple questions on the text I want to get to. Then we're going to get back and we're going to give you a real life example of what this actually looks like when you are a direct primary care patient who needs a certain level of care and how that works with a med share. Because I think an example may be the easiest way for people to wrap their heads around it, because the hardest part about this is that it is nothing like what we've been doing, right? That is why it's so hard for people to sort of wrap their heads around, because we've all been brainwashed into thinking that the way we're doing it is the only way to do it, when in reality, it's a much different situation. Mandy, are these folks paid advertisers? I hope you just heard their commercial a moment ago, but they are not in here. They did not pay for this. I am not being paid for this. We are not paying each other for this. I think this is so critically important, and I'm hearing from so many people that are being priced out of the insurance market that we've got to do something different. And if you're thinking about dropping coverage, don't do that until you go and talk to Travis at chat or pinnacleapc.com about these various plans. He can connect you with all of these things and really help you out. So I want to start, Dr. Dyer, I am coming to you. My regen revolution, regenerative medicine has failed, even though it hasn't in real life, because I feel amazing. But anyway, I come to you and I need, you're like, dude, your knee's jacked. What do we do there? First of all, do I need an MRI? Do I get x-rays? What's included? What am I doing here?
Okay. Well, so you come to me with knee pain.
I'm a member. I pay my membership fee every single month.
Exactly.
Right.
Yeah. You come in, you say, Dr. Dyer, I got some knee pain. I say, well, I'm sorry to hear that. Mandy, why don't you hop up on my table? We'll do some history. We'll ask some questions about when it hurts, how it hurts, does it swell, that kind of thing. And then a physical examination where we can get a lot of information about what might be going wrong with your knee. Sometimes imaging, like you mentioned, x-ray, MRI, would be appropriate. Not always, but we can usually decide that based on the history and physical exam. Let's say that you had arthritis, for example, which is a very, very common condition that causes pain in the knee. We could get an x-ray. We have radiology partners that we can usually get an x-ray for $70 to $85, something like that. And then that would help us in the diagnosis. We say, okay, we know for sure now the pain you have is from arthritis. Well, there's all kinds of different things you can do. And I wouldn't just knee-jerk send them to Smith Medical to get a knee replacement.
Intended.
Exactly. Yeah. Hey, you picked up on?
Yeah, I did.
And so we could do oral medications, physical therapy. We have great physical therapy partners who are also cash-based that we can send our patients to, and they do really, really well. We can do joint injections right there in the office. So there's all kinds of treatment modalities that we can offer.
Right.
However, if those are not working and we say, hey, listen, you're getting to the point where this is really a quality of life issue. This is limiting your mobility. This is, limiting your happiness. We've done everything else. Why don't we go ahead and consider thinking about knee replacement? And that's when we would refer to Smith Medical.
Now, I want to talk about the financial side of this transaction, because you've got a membership fee that gets great access to your doctors, gets you plenty of time with Dr. Dyer. But if we're talking about, okay, we're going to do physical therapy, that would be a cash pay physical therapy office. And I'm not asking you for their price list, but the thing people need to understand is everything is up front. You know exactly how much something costs before you commit to it, agree to it, or go to it. So this is not like where you're waiting to find out what your copay is going to be when you get the bill later after you go to physical therapy. This is all up front, which for me is very, very appealing. Now, when you're talking about imaging and injections and things of all that stuff costs extra, correct?
Yeah, imaging is out at a radiology center. So they have, we have negotiated prices with them for our patients for cash-based prices. So since it doesn't go through insurance, they don't have to have the overhead to do the billing and coding stuff, just like we don't in DPC. So they can just give you a price right up front, and we get the imaging we need, and then we can make that decision. For a joint injection, it's like the cost of the meds, plus I think it's a $10 fee that we do, so it winds up being like $12 for a joint injection.
Because I think people think that you guys are charging the crazy, outrageous prices, but the reality is you're charging wholesale prices because you don't have to pay for the insurance middleman.
Right. Yeah, that's not a stream of revenue for us. We're not trying to. Yeah.
Oh, no, go ahead. I didn't realize what time it is. I got to take a break. When we get back, I, the patient, am going to Smith Medical. We'll talk about that next. All right, we are are back, and it feels like Christmas when you find out how much you can save on your healthcare costs using a completely different method other than health insurance. Okay, I am joined here in the studio with Dr. John Dyer. He is one of the founders of Pinnacle Advanced Primary Care. You've heard me talk about them now for years. Then we have Lisa Fagan from Smith Medical, because they are now a cash pay critical care office. They do surgery, they do your big stuff, and every price is upfront. You can do what I do. You can go and look at their pricing menu and map out your plastic surgery that you may want to have, just in case you're thinking about that in the future. All the pricing is there. And joining us via Zoom is Preston Guthrie from Zion HealthShare. And I just told Preston on the break, I'm like, boy, Preston, I got a lot of questions for you, because I think people are starting to understand the direct primary care, and we're coming to you, Lisa, for my fake knee surgery that I need. I think they understand what you do, because it's pretty straightforward. The health share part is the part that we're going to ask a bunch of questions about in just a moment. I do want to answer this question. Hey, Mandy, wouldn't it be better if doctors went into private practice again? Seems to me like it wouldn't be a bad idea. And I got to tell you, this took me back to my childhood when we saw Dr. Ozaki, the best pediatrician, that finally kicked me out of his office when I was 21 years old. They made me get a new doctor. But when I was a kid, you went to the doctor and you walked in and they said, okay, this visit's going to be $25 or $40 or whatever it is. And you paid the money, and then you saw the doctor, and the doctor took care of you. And if you needed anything else, like a strep test or whatever, you paid for that. That was just a thing that you paid for. That is what this is. So in a way, it is a return to private practice, but without the massive, cumbersome infrastructure that is required to take health insurance. Do you guys know, either of you, how much health insurance adds to the cost of running a practice? I'm sure you have some idea.
Upwards of 40%
That's what I've
is
heard.
the overhead
Yeah.
for having a billing office where you fight with the insurance companies nonstop in order just to get the payment.
I want to come to you, Lisa, because now Dr. Dyer has examined me. We've tried some stuff. And he's like, nope, you need a knee replacement. I'm going to send you to Smith Medical. What does that look like when I hobble into your place?
Yeah, absolutely. So the process from there is he sends over the medical records, which is great. So we know what's going on. So we could immediately call the patient within 24 hours or less, right when we get the referral. So it's a fast process. We ask them like what their priorities are on like surgeons. So we give them options on like, we have multiple surgeons that can do a total knee, since that's what you're getting done. And then we refer them over to the physician, and the physician gives them a call and sets up a consultation. We make sure that they have all the right imaging that they'll need so that it's fast and they don't have to go back and forth. From there, once they see the patient and they want to move forward with surgery, then we give them an upfront price prior to the day of surgery, which is very rare in healthcare, as you know. And if they have a group share plan like Zion, we reach out to Zion, let them know that this patient would like this, and we work with their group share process.
Does that help? And I want to come to Preston for this, Preston, because a lot of people have questions about what health shares cover, what they don't cover. And there's a lot of concerns about that. So the current example of the full knee replacement, you get a call from Smith Medical that says, hey, Mandy is going to get a full knee replacement. What happens on your end at that point?
That's a great question. Now, I'm going to correct one thing really fast. We look at the word covered as a bad word. So they are an eligible sharing request is what we call it. So that was a hard transition for me coming from the insurance world. But what we want to do is we want to be involved in this whole process, right? When this patient goes to see their provider and they say, man, my knee's hurting really bad, like that's where we want to start looking at opening a sharing request process. Because now we look at this from a point of view of we want to help you through this whole journey. Because if the doctor just says, hey, let's just do some physical therapy, okay, let's figure out how much it's going to cost. We have something that's called an IUA, or an initial unshareable amount. People at home are probably thinking in terms of insurance, and that would be like their deductible. But we look at these IUAs on a per event basis. So this whole knee situation is going to be one IUA. So they're going to go see their doctor. The doctor is going to prescribe them, hey, let's either get you into an orthopedic surgeon, let's get you into surgery, let's do all this stuff. And now when we are working with Lisa's team, now it's hey, we're going to make sure that we're trying to get the very best rates, the very best cost. and then we're going to take care of the payment. Whether the patient wants us to just send them we can do like a virtual card so that way they can walk in and say, hey, here's the card, they'll pay for it, or we can send the payment directly to the surgical center. We can reimburse the member. We don't love doing that just because then it gets sticky. We want to just remove the hassle. Getting a surgery is always a scary situation, and we want to be able to help them. The other great thing is when Lisa's team reaches out to us, or when the member reaches out to us, you're assigned a member needs person, and you're going to work with them through the entire time, right? So you're not trying to call in, find somebody new, work with somebody different, try to explain yourself every single time. You're going to work with the same person, and the process is going to be familiar to them. Like, they're going to know the situation, they're going to help them, and they want these people to feel like, man, like, all this health insurance and paying for healthcare is scary. Let's try to remove some of that burden and lower that cost, hopefully significantly.
A lot of people on the text line are asking questions about who is the final decider. Is there a committee? Is there a group of people? Is it like we put it on the internet for a vote? I mean, how does that work? On what gets approved,
as far as
what gets
getting
shared,
it paid
and
for?
and what gets shared and what doesn't.
Okay, so we have, like I said, we have our member guidelines. They are on there. You can go through and read them, right? So, like, for example, while we were on the break, I went through and I looked at knee or joint replacement surgery, and it says in there that these are generally eligible for sharing, right? As long as they're not falling in that pre-membership situation, right? Like, hey, you sign up for Zion HealthShare after you hurt your knee and you're like, man, I want to get this cheaper than my $20,000 deductible with my health insurance, right? But if it's not considered a pre-membership situation, then yeah, that most likely is going to be considered a shareable event. Now, the one thing that I want to make people comfortable with is if something is within our guidelines, we've never not paid it, right? That's something that we want people to feel comfortable with, on like, hey, we are here to help the community pay for their health events that get scary, that get expensive. That's what this whole thing is for. We're trying to avoid going into the profit route, and we can focus more of that money into this. Now, we do have an appeals committee as well. If something comes back as like, hey, we felt like that this didn't really fit into our guidelines, we actually have an appeals committee that meets every Thursday. And you can come back and say, hey, I feel like this should have been shared into, and I feel like this should have been paid for. And we take each one of those very, very seriously. And we're constantly looking for opportunities to pay for those shareable events.
It sounds like if someone is going to sign up with Zion HealthShare, they need to go through and read all of the information before they sign up, so they have a very clear view. So it sounds like transparency here is where you're coming from. And if people just take the time to educate themselves, they'll have a very clearer picture on what is covered and what is not. And again, I'm now getting people saying, well, do they cover regenerative medicine? Those are questions that I'd rather you guys direct towards Zion specifically, or go look at their website. Okay, now, oh my God, here we go, you guys. Here we get, Preston, we're going to be here all day. How do you deal with ER situations? Emergency room situations. When your kid falls off their bike and breaks his arm, what does that look like?
That's a great question. And that's such a normal thing for people to deal with, right? And that's what I would say that the things that I get asked the most are like, man, what if my kid breaks their arm? Or like, what if I'm diagnosed with cancer? Like, those are the things that people always want to know about. And what you do is when you go to the ER, you present yourself as a cash pay patient, right? That at the ER is going to unlock all of these discounts that they legally cannot offer if you walk in with an insurance card and say, hey, I've got insurance, I think I get a discount for that.
Wait, what? So I just found out a fascinating thing about Medicaid and direct primary care here in Colorado. And now I'm finding out that they legally cannot tell you how much cheaper it would be if you just walked in and said, I'm going to write a check, so let's bring this under control. Yep.
Yeah. So if you walk in, you present yourself as cash pay. Now, we are coaching these members through it, right? So walk in, take care of your kid, say, hey, give me the bill, give me the invoice for this, give me an itemized invoice. Now you're going to reach out to us, and then we are going to walk them through how to negotiate potentially a better discount, and then help them pay for that situation, right? So they've got their IUA. Let's say it's a $1,250 IUA. They cover that part. And then no matter what happens with that broken arm, that shareable event is going to be paid for by us, right? And it's not just that situation. What happens in 6 months if they say, oh man, there's complications from that arm and we find out they need surgery? We look at that as still the same event and they don't have to pay for that surgery. That's still part of that same IUA initial shareable event, unshareable event.
I think the complicated part, or for some people, and I know that there's a lot of people that are going to get this and be able to grasp it very, very quickly, but it sounds like this is a more active form of engaging on your healthcare, meaning that we're all sort of trained like little trained monkeys. We go to the doctor, they tell us what our copay is, we pay our copay. We do whatever they tell us to do, no matter how much it costs, and then we get all these bills at the end and go, holy crap, that's ridiculous, and we end up paying 20%, right? So that's what we're used to. That's the standard. So here's a question. So are you paying the bill when you leave the door at the ER? Because cash is tight for people right now. So that would be a big concern.
So it's going to depend on the situation. If you want to, you can, and have the means, you can pay for it, right? But a lot of times you can get out of there with an invoice, or you can get out of there with paying a certain amount. Hey, I can put a few $100s down, bill me for the rest. And then that's going to allow our team to like really coach them through, hey, here's how to get more discounts. Here's how you negotiate this. Here's how we can get a better rate for you. So it's interesting, Mandy, because I come from the insurance world. I was in the insurance world for over a decade. And all of these big insurance companies will come and they'll sit down in a business owner's office and say, hey, we're creating consumerism here. But then when you got a mom that's taking their kid to the doctor or to the ER, she doesn't know how to be a consumer. She's terrified. And
Right.
The only thing she's caring about is how to get her kid taken care of, right? There's no consumerism there. They get slapped with a bill and now they're just like, oh man, I guess this is just it. This is just what I pay for now. And with Zion HealthShare, we want her to feel like, hey, I know this is scary and I know that you just want to take care of your child. Let's try to make sure that the financial burden is as low as humanly possible.
Right. Remind us what an IUA is. People are asking that as well. People who didn't hear
That's
the initial
okay.
conversation.
So that is an initial unshareable amount.
Okay.
That's like a deductible, right? So think of it as like a deductible, except a deductible is like you have a big deductible for the entire year that you have to pay for everything until you hit the deductible. With Zion and with HealthShares, when you have an IUA, you only have to do that per event. And for households, you only have to do 3 of those in a year. So if you've got $1,000 IUA, you may only end up being $3,000 out of pocket if you have 3 of those big events in 1 year.
Okay.
And then on the 4th, 5th, 6th, we're going to cover it all.
So I want to ask, and by the way, if you have more questions, please call Zion if you have more questions. I know this is, it's so different than what we're used to, right? It's so different than what we've sort of been lulled into a false sense of. But let me ask you this, one last question for you, Preston, and then we're going to talk a little pricing with you guys too, because really this is the thing that's going to make people try it is the price. They're going to stay because of the quality of care. I truly believe that. I truly, truly believe that, especially when we're talking about direct primary care and direct, critical care. I really do believe that once they experience the level of service they're getting outside the system, they will want to stay. But Preston, how do your rates for policies for the initial, I don't know if you call it a membership fee, I guess, how do those compare to what people are seeing now with insurance quotes for thousands of dollars per month with a $10,000 deductible?
I'll use my mom as an example. She just signed up for Zion HealthShare. Her and her husband just retired. Her husband's already over 65. She's still in the insurance bearing years, right?
Yeah.
And she came to me and she's like, Preston, I don't know what to do. My premium went up to over $1,000 a month just for her. She's got a high deductible health plan, HSA, all that stuff. And I was like, well, Mom, just go to our website and sign up there. And she saved over $700. So her premium for insurance was over $1,000 a month. And her monthly contribution is just over $300, right? Now, it's just her, right? If you're a family, if you're a couple, like we rate those things out based on your demographics and age and all that. but it is a massive, massive discount as to what people are used to paying for. And with how much higher things have gotten this year, I mean, we've had more people signing up, I mean, this week than any other week we have in the last
Oh, I'm sure.
ever.
I'm sure. So let's get to direct primary care. And I'm wondering, you guys have been doing this for a while. Have you had the chance to either ask patients or analyze? And I know Travis, your CFO over there, your CXO over there, is a numbers guy. I'm wondering how much people are paying out of pocket realistically annually compared to what they would be paying if they were paying a high premium, high deductible plan. I'm curious what those numbers look like.
Well, it's hard to say exactly because it does kind of depend on age and risk,
Right.
and also it keeps going up every year. So that's the thing. I think our memberships really have not gone up for $10 in the last 5 years or whatever it's been. But yeah, I mean, our memberships start at $79 a month, and you go to our website, it's all listed there, just like Smith Medical has their surgery prices listed. We have family pricing, we have business pricing, and there's some modifications just based on age and complexity and those kind of things. But that's
You're
where it
cheaper
starts.
than direct primary care in Florida. I looked it up today.
Well, yeah,
You're a bargain at twice the price, but here we are.
we
So-
are the best.
Yeah. And at Smith Medical, how has the response been? Are people starting to get it here? Because in Oklahoma City, the Oklahoma City Surgical Center has not only provided a cash pay option for people who self-insure or maybe don't have great insurance or have a high deductible, but they've also kind of suppressed pricing at the surrounding hospitals, showing that competition really does work. So are people starting to get it when they need surgery?
Yeah, patients are really enjoying it because especially if they're the uninsured, this is a bundled transparent price. So it's just one price and it's laid out to them before surgery. So they're really enjoying it. We get lots of calls and we're like, so we got this one up for total joint. We're up in the mountains and they said just for the facility is $75,000 for total knee. And I'm like, oh, ours is all in. And they were like, no, that can't be right.
I'll be driving to Denver.
Yes.
No, but for real.
So they
and
do.
Do you guys have financing options available for people?
Yeah, we do work with a couple of financing options.
Okay. Preston, I want to ask you one more question about HealthShares before we have to wrap up. And that is your plan not right for some people? And if so, who are those people?
I would say yes, it is not right for some people, right? People with chronic existing conditions were not a good fit. I typically tell people, hey, if you're relatively healthy and you don't have any chronic long-standing issues, Zion's going to be a fantastic fit, right? The whole point of what we do is having it be a community shared program. And so if you are relatively unhealthy, you have a chronic condition, it's not a great fit for the betterment of the entire community's financial concern.
So and also your plan is not a do you have a religious component? And I do know like there's other med shares that are Christian based, or there's a religious component. Does Zion have that?
That's a great question. We don't have any requirements that anybody is necessarily faith-based or part of any specific denomination, right? We are mostly faith-based within our company. We believe in a higher power, but we don't have any requirements that say, hey, you must be XYZ religion for you to be part of our community.
All right, that is perfect. Okay, Dr. Dyer, you want to have any last words for the audience on our healthcare roundtable here?
Yeah, I'm just happy today. I mean, getting to talk to these partners that we've worked with for several years now. I just want everybody to think about a year ago, just over a year now, when that dude, Luigi Mangione, shot the guy in the back, Brian Thompson, and then people acted like he was Robin Hood or something, like he was saving everybody from the terrible healthcare industry and all this kind of stuff. But you look at his stupid manifesto, he had no solutions to offer, and he just wrote that out. But these people actually do have solutions. And these are the people I like to work with. And that's a much better solution than shooting a, married father of two in the back.
I agree. Lisa Fagan, any final words from Smith Medical?
Yeah, I think that it's really important for the consumer to look at their choices, see what's out there. Even if you have health insurance or high deductible plan, there are more affordable options that can save you money right away.
And I'm just going to say this. I would urge all of you, and I put links to all of these places on the website today on mandysblog.com. Do what I did. Go look at their price list. And I'm not saying that I've been thinking about a boob job, but I'm like, well, that's all it costs? I mean, Come on. I'm just kidding. I'm not. But I love to look at the prices. And it gives you some perspective about when you get those 50 pages of bills with your insurance. My daughter, I won't even tell that story. I can't even. You just get the bills and the pages and the pages and the pages. Any final words for our audience, Preston, before we have to go?
I would just say that there are solutions out there, right? Especially with what's going on in the government. People don't know, hey, what's going to happen with my subsidy? Is it just going to be completely unaffordable? There are solutions out there. Yeah, we would love for everybody to join Zion Healthcare, but it's something that we want you to do your research. Reach out to us, call us. We've got fantastic partnerships, and you can see with these three companies together, we're putting solutions in place that make a big difference for everybody involved.
I got one last comment for you, Preston. I'm a member of Zion HealthShare, says this texter, and had to take my child to the ER. They paid it 100% after I met my IUA. They held my hand and let me take care of my child instead of stressing out about what I had to pay. The ER didn't require any payment up front. So I don't know if that's your mom, but well done. Guys, I so appreciate everyone making time today. Dr. John Dyer and Lisa Fagan and Preston Haney from Zion HealthShares, thank you so much for making time. I hope this at least spurs people into looking into it a little bit more and finding out what their own personal situation and questions, get those personal questions answered. Guys, thank you so much for coming in.
Thank you.
Thanks.
All right, guys, tomorrow,
Thanks,
two
guys.
of the days, we'll be back. Keep it on KOA.